everybody. This is Dr. Lisa Gordon. Today we are going to switch it up a little bit. We're going to be talking about some structural stuff. So this is Dr. Lisa, the chiropractor, talking to you. And we are going to be talking about carpal tunnel syndrome and wrist and hand pain. I have a whole lot of patients coming to me and saying, oh, I need to have surgery for my carpal tunnel. And every time their hand hurts, they think it's carpal tunnel and whatever. So what I want to do is give you some definitions and also some at-home remedies for when your hands and wrists hurt, and let you know that we always have free consultations for people who need to come in for, or even to just talk about whether they do need to come in for a visit or whether they can do things at home. And our number is 667-240-2923. And I am Dr. Lisa Gordon. I've been a chiropractor here in Howard County, Maryland for 33 years now. And I'm very experienced. I've helped a lot of people avoid surgery for carpal tunnel and many other things. And my practice consists of chiropractic, cranial work, nutrition response testing. So I help a lot of people balance their bodies, get their hormones balanced, get through menopause more easily, all sorts of things, thyroid, digestive issues, chronic pain, all those sorts of things end up getting better, because I know that if a body is out of balance, that it has symptoms. And that's actually true structurally as well. And when I say structurally, what I mean is the structure of the body. So if you have bad posture, it's going to affect everything. And if you're doing things repeatedly, I'm a knitter, so I knit a lot. And so my wrists end up hurting me sometimes, and my neck ends up hurting me sometimes. And I have to remember my own advice and go ahead and sit up straight and do the stretches that I'm going to teach you and so on. So let's get right into it. Carpal tunnel syndrome is, the definition of carpal tunnel syndrome is when the nerve that comes into the hand gets compressed. So this nerve that comes through here can get compressed by this piece of tissue that goes over it. And there's a nerve that goes through there, and when it gets compressed, just like sciatic pain, just like neck pain, that kind of thing, you can end up with nerve problems. So that feels like numbness and tingling, usually in these three fingers, in the thumb, first, and middle fingers. That's called the median nerve. It's the nerve that gets compressed, and that's the distribution of the median nerve, the thumb, first, and second fingers. Sometimes people get numbness at night, or even if they're in a bad posture, they can get it during the day. Now that we have TextNet, a lot of people are getting pain and numbness going all the way down into their hands because their head is forward like this, and the nerve gets compressed even at the level of the neck. Once carpal tunnel gets really bad, in other words, that nerve has been compressed long enough to damage that nerve, the median nerve. This muscle here, it's called the thenar eminence. This muscle, this musculature, if you will, can get weak and get smaller, atrophy. It can lose its bulk. So as a chiropractor, I've got a lot of bulk there, and some people have a lot and some people have a little. If it changes and if you have all this pain, then that could be an indication that you have carpal tunnel syndrome. But you're going to know about it long before that, and you're going to be calling somebody for help. Hopefully you'll call a chiropractor who knows how to deal with this kind of thing without surgery. So the bones, what happens is the bones of the wrist can get separated, and they can get what we call subluxated in chiropractic. So these bones can get separated, and you can see that then that would create a situation in which this tunnel that goes through here would get flattened. So this gets wider and flatter, and the nerve that goes through there gets compressed. And then you end up with trouble in the places where the nerve goes, which is this part of your hand. And it can cause people to not be able to pick up a cup. It can cause people to drop things. It can cause enormous pain. Now, is that the only thing that happens with a wrist? No, it isn't. There's also something that happens a lot of times with the pain, the tendon that's right here, And this tendon, when it gets injured or damaged, if you do this with your hand, you put your thumb in your hand like that and pull, this hurts like crazy. This has a big fancy name. It's called de Quervain's tenosynovitis, meaning that this tendon is inflamed and has a lot of trouble. Again, that can be extremely painful, and it can be corrected over time by a combination of chiropractic adjustment of that wrist and hand area, and even the elbow. Sometimes the shoulder and neck are involved. Even sometimes the lower back is involved. Sometimes posture is involved. So those are hard things to deal with. So we sometimes need to add nutritional supplementation. We need to change the diet. There are things that can happen to make that heal without getting surgery. Surgery is not a first thing to do with these sorts of things, because if they cut this part of the wrist, that will never grow back again. That's never going to be the same again. I don't even know if there is a surgery that they do for the de Quervain's tenosynovitis. I imagine that there is, but I can't even imagine getting that cut or something surgical done to that. So what can you do about this? What you can do is you can use wrist splints if you want to. Sometimes at night people sleep like this, and that can cause a lot of stress in the wrist. Neutral for a wrist looks like this. So pretend this is a table. If you were to put your hand on a table, this is neutral for a wrist. So when you're lifting weights, you shouldn't have your hand like this, lifting the weights. You shouldn't have it like this, but rather you should have it central 35 degrees. Now you've got a nice strong wrist. So you can lift things like this. 35 degrees is neutral and strong for a wrist. If you're doing this a lot, or this a lot, or this, you are going to damage your wrist and you're going to have pain. So be aware of this. If this is the one tip I can give you, have your wrist in a neutral position when you're doing any heavy work whatsoever. And this includes getting things out of the oven. It includes picking up a frying pan, something that has stuff in it. Be very careful of your wrists. We have a lot of bones in here. We have 8 wrist bones. We've got these 5 bones that attach to those, and these 2 bones plus all the other wrists of the hand, of the joints of the hand. In chiropractic, if somebody like me knows what they're doing, I do. We can adjust all the joints of the hand. We can get everything back in alignment so that it's fully functional. There are exercises that you can do. Let me show you some exercises. When you want to stretch the wrist, you want to just gently take your hand and go like this. Now, I just said that you don't want to sleep like this. No, you don't want to be like that all night. But if you're just stretching it gently, you can do this. You can straighten your arm and stretch it. And then you get a nice stretch of these muscles in here that actually attach to the wrist and the hand. If these muscles are constantly shortened, then you are going to have a problem in the joints that those muscles cross. They cross the wrist, they cross the elbow. So you could end up with wrist pain. Let me get this down a little bit more so you can see me better. So you can get problems in your elbow, you can get your problems in your wrist, in your hand, and your shoulder. If you are constantly playing video games, if you're constantly on your phone, if you're constantly doing this kind of activity, you're going to have trouble because you're curled around constantly and your hand doesn't only go in that position. You can stretch your hand. Sometimes when I'm knitting for 10 hours a day, which I sometimes do, I will like to stretch my hands every half hour or so like this. Stretch your thumb. Stretch like this. Stretch like this. So you learn things about me on every video, right? You didn't know that I could knit for 10 hours a day. I do that. All right, so those are good. You can do circles with your wrist like this. You want to have them go through the opening, closing and opening, all the ranges of motion that you have. Open your hands up like this. Open them up. Close them, open them. You want them to go through their ranges of motion. And if you're noticing while you're doing any of this that you're having pain, that's the time to get a professional opinion. I'm a professional. Give me a call. I love treating hands and wrists. They're really easy. So you don't have to make it complicated. You don't have to go and get lots of different tests and surgery and Steroid injections are not a good idea, because if you have a situation where you have inflammation around something, sure, if you decrease the inflammation artificially with a steroid injection, it will make the pain go away. If you just want to make the pain go away, go ahead and get a steroid injection. However, the pain's going to come back because the problem was never solved. If you have a problem that is causing inflammation, do you just want to change the inflammation, the symptom? Or do you want to know what the cause is and fix that? Well, that's what I do. I help with fixing the cause. If your cause is simply tense muscles, you can fix your cause. So you do the biomechanical things. You do the stretches that I just taught you. Stretch your arm, stretch your hand, that kind of thing. Do big circles with your arms like this. Stretch and in. Go back and you can watch them again. All right. You can even go individual fingers like that, but be careful because you can overstretch. Just be very slow, be very loving and gentle with yourself. You are precious. Okay. So when you have surgery, I just read this statistic. If you have surgery for carpal tunnel syndrome, these are your chances. Only 25% will have complete relief after carpal tunnel syndrome. Carpal tunnel revision surgery is what they call it. 50% will have some relief. 25% will have no relief. So wouldn't you rather handle it naturally? Find out if your body's missing some nutrients. Sometimes you need B6. Sometimes you need something else. Sometimes you need some support for the ligaments. We can figure all that stuff out. It's not that hard. It's not hard at all, really. Okay, so hand and wrist things can get worse with daily activities like lifting, crafts, cooking, computer work. Whenever you're doing something over and over and over again in the same posture, you need to do the reverse of that also. So if you're always curled over, this is how you're going to end up. You're going to end up one of those old people who can't stand up straight. However, if you do the opposite, you'll give your body the full range of motion. It's very important. Okay, so these structural problems can almost always be corrected with chiropractic extremity adjusting along with spinal adjustments. When I use the word extremity, I mean things outside the body. So shoulders, elbows, hands, wrists, even ribs, skulls are sometimes considered extremities, although I don't really consider it an extremity because I do skull adjusting with I check people's skull with every adjustment that I do. And I do this gentle cranial work to make sure that the tissue around the brain and spinal cord is functioning properly. That's just part of my chiropractic work that I do. And that kind of makes me a little different from other chiropractors. The extremities include hips and knees and ankles and feet. In our practice here, what I do as the doctor, I adjust from head to toe. So if anything needs to be adjusted, TMJ is included as an extremity. Anything that needs to be adjusted, and adjustment means a chiropractic treatment to realign the structure, the bones of the spine and of the extremities, which I've just defined for you. So what I want for you is for you to be healthy and flexible, to age well, to be in balance, to have the nutrition that you need, and just to be super healthy. So please think about this, do these exercises. I'm really happy to have a free consultation for anybody who wants one. And the way that we do that is that you call us at 667-240-2923, and we schedule you for a free 10 or 15 minute phone consultation, and we get a nice feel for each other and figure out exactly who we are and what you need and how I can help you. And I will see you next Tuesday. Bye.